Are you vexed about what's happening with the COVID-19 vaccine? Don't worry, you're not alone. There have been a lot of things in flux with who can get the vaccines and what you have to do to actually get them. So here's what's happening. In August, the Food and Drug Administration approved this season's COVID booster for adults aged 65 and over and adults aged 18 to 64 with at least one underlying health condition. But they removed an emergency use authorization that simplified access to COVID vaccines, which has left pharmacists, doctors, and patients confused about who can get the shot. VPM News asked Virginians via social media what they'd experienced, and we got hundreds of responses. Some were able to get the updated shot without a prescription, others weren't, even from the same pharmacies. A 70-year-old woman told the team that she was able to get an updated COVID shot at a CVS that just refused her a week prior. Just got my updated COVID vaccine at CVS that doesn't have a minute clinic. I was refused last week. And several users shared they plan to travel out of state in order to get the latest booster for themselves or for their children. Worm42 on Reddit says, the lack of clear information is maddening. Every pharmacist I talk to says something different. Even people on different shifts at the same pharmacy may be inconsistent. In an effort to clarify some of this confusion, Virginia Health Commissioner Karen Shelton issued a standing order authorizing pharmacies to give the COVID vaccine to adults aged 65 and older and adults 18 to 64 with an underlying condition, even without a prescription. It says eligible providers shall administer the vaccine in accordance with state law and then lists the available vaccines. So this is where things stand for now. But a federal vaccine advisory board is scheduled to meet later this week. That board is now made up of people appointed by Health and Human Services Secretary Robert F. Kennedy Jr., an outspoken skeptic of vaccine safety. They'll discuss COVID-19 vaccines and decide whether to include this season's booster shots on the CDC's vaccine schedule. For more coverage of this, go to vpm.org.